All right, very good, very good. So we still have a minute or two, so we're a couple minutes early. So but we are live, and so we want to welcome everybody that would come on this virtual panel discussion on COVID-19. And so we're going to give it a minute before we officially start, but we are excited tonight about what we're doing. Foundationally, I'm excited because Pastor Aisha's with me. So if she's with me, I'm just excited. So foundationally. But we're going to introduce our wonderful panel in a minute. So we'll kind of give that a minute before we do that. But as you're joining tonight, we welcome you this evening. So glad that you're jumping on. It'll be a good investment of your time with what we're going to cover tonight for this panel discussion on the COVID-19 vaccine. I think it's stuff like this is so important. Sessions like this are so important because there's so much information that's out and coming out and so forth. And when you're in a situation like ours, having actual doctors and medical professionals in our congregation, it makes a big, big difference. And so we are very grateful for that.
And we just want to encourage everybody tonight that's viewing us tonight to make sure you like this, you share it. Just even in our time of talking with different people, there are different people that may be on the fence of, either getting the vaccine and for a number of different reasons. Some reasons they're not sure of. Some things they may have some questions. Some things they need more understanding of. Some things are dealing with myths. So make sure you take the time to like it, to share it, so that people that may be on the fence due to things they may not understand or have questions on, you make sure you share this so that they can get possibly the questions that they need to get answered to make a very informed decision. We will also allow some time. We're going to preferably be able to have some time at the end to have some Q&A so that people that do have questions that maybe don't get answered, we will give some time for that as well.
Yeah, so if you could share it, please share it on your social media platforms. That's vitally important. So please do that now if you can, and that'll help us get the word out. Well, it is 6 o'clock, and so we want to go forward because we have a lot of ground to cover in a short period of time. That's like Smokey Bandit. That's a Smokey Bandit. We got a long way to go and a short time to get there. You remember that, Dr. Oge? Do you remember that, Dr. Oge? You don't remember Smokey and the Bandit? And so, all right, very good. Well, I am, again, welcome to everybody. And we're excited that you're with us tonight. Tonight is going to be an awesome time as we are discussing the COVID-19 vaccine that's out. You may or may not have heard that next weekend, Victory is hosting a COVID vaccine distribution center, and we are going to be dispersing the Pfizer vaccine under the guise of all the medical professionals and so forth. And so tonight is in preparation for that, so people can get information, get questions answered, get accurate information. And so we are ready to go. So let's dive in. I see people joining on YouTube and Facebook. So good evening. I want to turn around and introduce our panel. These are precious people that are part of our church, and I'm going to take my notifications off. I'm a multitask. These are precious people that are part of our church, and they are wonderful, wonderful individuals that have the heart of victory. And I'm so appreciative that they are on with us, because long days for everybody. And I get it. And they were willing to come on and be a part of this. And so I am just excited that they are with us. And so I'm going to have them introduce themselves in a minute, so you know who they are. You might have seen them around, seen them on the floor serving and running around. And I love that. These are doctors and medical professionals that are provision for vision in church. I mean, that sets a wonderful tone and example. And so I want you to hear from them tonight. Pastor Aisha and I are just going to facilitate it, but I really want you to hear from them as we're going to go through this journey together. And so first, I guess we'll do the ladies first. And so Dr. May Tench, could you unmute your mic and could you introduce yourself to our viewing audience tonight?
So good evening, everyone. So glad you took the time to just have some interest in your health, to take care of the temple. Amen. I'm Dr. May Bola, affectionately known as Dr. May, a little easier to pronounce. I am board certified in family practice and obesity medicine. Basically did bachelor's at University of Penn in Philly, did my medical school at Temple, and then I came over to New Jersey. I currently work for Inspira Health System in Buena, New Jersey. So I've been practicing for 25 years.
Wow, very good, very good. Well, we are so excited and privileged that you're with us tonight, and we thank you for your time. Nicole, we'll come to you. Ladies first, we'll come to you. Can you introduce yourself to everybody tonight?
Good evening, everyone. My name is Nicole Brown Young, as you can see on there. I am a registered nurse. I'm certified in emergency nursing since 2013, but I've been a nurse for 26 years now. Graduate of the University of Pittsburgh main campus back in 1995, and I am currently working. I work in interventional radiology as well as help out in the emergency room at Einstein Medical Center, Philadelphia campus. And I'm so glad you guys logged on tonight to get accurate information. There's a lot of misinformation out there, and we want to dispel those myths and give you the information you need to make a intelligent decision, a well-informed decision. So thank you so much for your time this evening.
You sound like a nurse. You sound like a nurse. Very good, very good. And then last but not least with us tonight is Dr. Oge. So Dr. Oge, Dr. Oge is cool. He's just cool. Could you introduce yourself to the people tonight?
Good evening, good evening, good evening. I'm really excited in what we're about to do tonight. I'm grateful to Bishop and Pastor for creating this opportunity to allow the people get more information. My name is Dr. Oge. It's just like OK, but with a G. I'm an associate professor of pediatrics. I work at St. Christopher's Hospital, which means I deal mostly with babies and young children. I specialize in neonatology, which means I deal in the intensive care unit, and my specialty is lung and heart failure. I also do what we call ECMO, which is like bypass for people whose lungs and hearts are failing, but principally for children. I've been practicing for 23 years, and I'm honored to be part of this panel.
Awesome, awesome, awesome. So appreciate you guys sharing. These are qualified individuals tonight, and we're so appreciative to have you talk to our church family and other precious people that are watching that would want to get more information about the vaccine. Who's not on tonight is Dr. Robin. Did you want to just quickly just reinforce Dr. Robin Smith?
Yeah, Dr. Robin Smith, she's also a partner of Victory. She works with the Jefferson Health System, and her specialty is gynecology and oncology. And she has been she has her own private practice now, I believe. And she has been in practice for, I think, a little bit over 20 years as well. So she could not be with us tonight, but she has been a part of the medical advisory board that we have been having for, quite some time now.
And so these are well qualified individuals. If we add up all the years y'all been doing it, we have a whole lot of years. And again, really appreciative. This is a reinforced promise to Pastor Aisha and I that God told us before we started the church, he would always send to us what we needed to do what we needed to do in every season that we found ourselves in. And this is a godsend to have doctors. It's one thing to have doctors, that would be great to hear, but when you have doctors that are part of your church, the culture of our church. And to have that tonight is really, really important. So let's dive in, since now we've introduced everybody. Pastor Aisha and I, we practice spiritual medicine. We've been practicing for a long time. We can cut people open and get them healed back in Jesus' name. But if you have a cough, we send you to Dr. Oge or Dr. May or Nurse Nicole. So very good, very good. So let's dive in tonight. And so Dr. May, you're going to set the tone by just giving some clarity about COVID. I know a lot of people now, after a year of this, are familiar, but I think you're going to kind of just reinforce and make sure our perspective is straight about COVID, because we've kind of been living with it now. And I think sometimes we can kind of forget. And so if you could kind of reinforce that before we then dive into kind of looking at some of this other information.
Amen. All right. So I want to start a little bit from the beginning, because sometimes we just assume that everybody knows what we're dealing with. And if we're trying to give you a treatment and you don't know why you're getting the treatment, you usually don't want it. Okay. So we just want to clarify, what's really going on. So this coronavirus, or COVID-19, coronavirus is a cold virus, a virus that causes a cold usually. So we've seen coronaviruses in the past, but we have not seen the coronavirus COVID-19 previously in humans. So this was a new virus for us. So that's why you're probably asking, why do they keep changing things? Why do they keep changing? Because it's new in humans. So as physicians, as researchers, we've had to constantly follow and look and see what this new virus is doing in order to figure out how to deal with it. So that's why you see things changing so much. So I want to talk a little bit about what are the symptoms of this virus. So the virus, a lot of it acts like a cold virus: fever, chills, problems breathing, tired, muscle aches or body aches or headache, sore throat, congestion, runny nose, maybe vomiting, diarrhea. Now, the symptom that was a little bit different that we weren't seeing as much is this loss to taste and smell. So a lot of times that was the newer symptoms that really went around with that. But now, so people say, well, how do I know if I don't just have a cold? Or how do I know if it's not just my allergies? You really don't know unless you get tested. So that's the problem. And herein lies the other problem. It can be spread when you feel fine. So most people got exposed before someone had symptoms. So that's why we're really trying to protect you, because by the time you know you're sick, you were already exposed probably 2 weeks ago. So that's why it spread so fast, because people didn't know they were being exposed. So unfortunately, you can get exposed when you don't see it. So now, what's the big problem with the COVID-19 compared to the other cold viruses? It is a much more serious condition. People can go on to the biggest problem being respiratory failure. Your lungs stop working, you can't breathe. And of course, if you can't breathe, you can't live. And we've seen a whole lot of deaths. Now, a lot of people say, well, you know what? I've known a lot of people and they got better and they stayed home and they did fine. A large majority of people can recover at home. We do see that. But herein lies the issue, the problem. There are many people that don't do so well. And of course, you see the hundreds of thousands of deaths from those people that don't do so well. So what do you do? So if you feel sick, yes, if you feel any of these symptoms, you want to stay home because you don't want to spread it to anybody else. You may do fine, but the person that you spread it to may not do fine, because they may not be able to handle it like you can handle it. And if you have more severe symptoms, you don't want to wait until they get worse and worse. So if you're starting to feel short of breath, or you're starting to have chest pain or confusion or problem sleeping or problem getting up, or it's change of skin color, all of a sudden you're pale or lighter than usual, gray or blue skin, or your nail beds are loosening, then you know, okay, this is serious. This is not a stay at home. This is a call my doctor or head off to the ER like now. So you want to, get a hold of this on top of it. Now, so who are the people in general that tend to do worse? People who have certain conditions are more likely to be severe. First of all, the biggest factor is age. 65 and older did worse. 80 and older were the ones that really were more likely to die from it. So if you're, a lot of times people were saying, well, I don't want to get the vaccine, I have problems. Well, you're the one that really wants to get treated or prevent this, because you're the one that's going to be more likely to be severe or die from it. Some of those conditions, of course, cancer, chronic, any kidney problems, lung problems, dementia, Down syndrome, heart problems. If your immune system is weak, it can be weak from HIV. It can be weak if you're on chemotherapy, if you have liver problems. Believe it or not, being overweight, or what we call having obesity or being really overweight, you're more likely to do worse. Believe it or not, pregnant. If you're pregnant, you're more likely to do worse because your body is busy working on, taking care of the baby. Sickle cell thalassemia. If you were a former smoker or a current smoker, your lungs aren't going to do too well with this condition. Transplant recipients, because they're on medicine that makes your system now not be as strong as it should be. Stroke or anything that stops you having good blood flow to your brain, and substance abuse. So these are things that if you have these conditions, you're more likely to be severe, possibly die from it. You want to prevent getting it if you can. Children are getting it less frequent. So that's why we've been concentrating a little bit more on treating the adults before the children, because we aren't seeing children do so bad. So this is a problem. I've been calling children the incubators or the germ magnets, because the children feel fine. And I've had patients where, oh, you know what, I had to go to my grandson's birthday party, and now they're in the hospital with COVID because the child felt fine, had nothing, or had a sneeze, and now grandmom's in the hospital dying from COVID. So it's important to protect ourselves, because unfortunately, the children will do fine, but their relatives may not. All right. Now, there are some children that will have severe disease, not common, but it can happen. So we still are looking to even protect our children as well. Children who have sicknesses are going to do worse. So those are things we want to think of. Races, it is different among different races. We are seeing it more often in African Americans, in Hispanic, Latino, in American Indian, and some in Asian. So, and why? Sometimes we don't know exactly why. Some of it is because a lot of African Americans, Hispanics are more likely to have these associated diseases, and including high blood pressure, diabetes. A lot of these races are going to have those problems. So that's going to make you more at risk. So if we can prevent you from getting it, that's what we want to do. Okay. Now, how is it spread? So there's been so much change over how it's spread. Before we were protecting from everything because we were trying to figure out, why is this going, spreading to millions of people? The biggest thing is being in close contact less than 6 feet. Why? Because most of it is spread from what we call respiratory droplets. When you breathe, when you sing, when you cough, some respiratory drops are coming out of your mouth and out of your nose. Okay. There are small droplets that you really can't see, and they tend to spread in the air. And they usually will dissipate and be the least likely in there by 6 feet. All right. Some of the heavier ones will drop to the floor, drop to surfaces. All right. So what have we done? So covering your mouth and your nose. So both, because some people you see, they got the mask down underneath their nose. Well, you're still letting the droplets out of your nose. So you got to cover nose and mouth. That'll prevent you from spreading it to people. And of course, if they're a mask, prevent them from spreading it to you. Now, surfaces. Initially, we were wiping everything down. Then they said, well, you don't have to do that anymore. Why? Because we found out we weren't seeing as much people getting tracing cases back to surfaces. What about the surfaces? If people are sneezing, coughing, or touching their nose, touching their mouth, touching surfaces, and you touch that surface, now you touch your mouth, your nose, or your eyes, now you're putting that in. So that's where the hand hygiene comes in. So if you can make sure you're not transferring that virus from your hands to where it can go in, then that helps. So even when this coronavirus goes away, we still need hand hygiene, because that's going to stop you from getting all the other stuff. If you can prevent from taking stuff from somewhere and putting it into you, that's a good thing. So I don't care what happens with this virus, keep the hand hygiene, very important. Okay. All right. So those are the main things as far as transfer. So what actions can we do? What we're doing the mask to prevent those drops from spreading. We're keeping 6 feet apart to prevent those from spreading. And of course, the other thing is, the better condition you are for your health, the better you're going to be at fighting something off. So if you have conditions, a lot of people were getting scared. I don't want to go to my doctor. If I go to the doctor, people in that doctor's office are going to have, and I'm going to get it from them. Less likely, doctor's office, we're trying our best to keep everything clean so that you're not getting that. And then the thing about it, you don't want all your conditions to be not taken care of. If you get sick, you're going to be worse. So make sure if you're on medicine, make sure you're seeing your doctor. And if you're concerned and you have some symptoms going on, make sure you call. Don't wait. So I'll take 2 seconds and share just a personal story. So my mother actually passed away of COVID in the very beginning, about a year ago. And I can almost tell you, can't prove it, I'm pretty certain she got it from church. Because what happens 2-3 weeks before they put all the restrictions in, I thought about it the day before the restrictions, the news was starting to say, oh, we think this is in the US, we think this is going to spread. My mom was 86, I'm sorry. She was on chemotherapy for bone marrow cancer. She was doing very well on all of her medications, but she was high risk. She had asthma. I knew if she got anything that was going to be a major problem. And of course, so that day when they started saying through the news, I said, oh my goodness, I'm gonna call and tell mom not to go to church. It was too late, she was gone. And in 3 weeks, the whole family went down. Mom went down, brother went down, sister-in-law went down. And the thing about it is she did not tell me that she had a cough for a couple of weeks. So this is the classic case. You know you have conditions. You went out to the place where everybody's hugging, kissing each other, all over each other. At the time we didn't know. We hadn't shut down anything. So I had a clue, but I couldn't catch her to tell her not to go. So of course, by the time she told me, my sister said she can't stand up. Ambulance took her away. In 8 days, she was gone. So now we can trace back to that. And at that time, it was spreading like wildflower. So now we're starting to see our numbers go down. Why are our numbers going down? Because the whole United States put in these restrictions. We put in the mask wearing, we put in the social distancing, and then we saw the numbers. And when that went off, when people started doing what they wanted to do, we see the numbers rise back up again. With each holiday, we saw the numbers rise back up again when people went out and did what they wanted to do. And then now we see the numbers going down lower and lower and lower, because now we're starting to see the vaccines. More and more people get vaccinated. So hopefully I gave you a little bit of just introduction, and hopefully if you already knew it, great. Hopefully we kind of helped you know that you're right, and hopefully you learned something otherwise. So thank you.
I love seeing you guys in your element. I love it. I love it. That's Dr. May for real. I love it. I love it. Mm-hmm. So thank you for that. And the reason we did that, we just wanted to set the tone, and I thought you did a very good job on just reinforcing our focus about COVID, understanding it. I think the more knowledge we have, the more equipped we are. So thank you for doing that. Dr. Oge, did you want to add anything in, or
yes,
you want to add?
Yes, please, and thank you.
I can see you look like you're ready to add something.
First of all, Dr. May, I didn't know about that. And, I just want to sympathize with you. I'm sorry for your loss. And sometimes as physicians, it hurts twice as much because we can't do anything. We feel helpless with all the knowledge we have. So I sympathize with you. And I'm proud to be associated with you that in spite of it all, you're still giving your all and trying to do your best for victory. So God bless you and strengthen you. Thanks for setting the tone and introducing us. I want to be just like you when I grow up. You gave us a lot of information. I just want to add one or two things. The first thing I want to start with is the virus. Maybe not just all viruses, maybe bacteria too. There are two different ways they attack you. The first part is the things the virus can induce in you, either producing poisons or toxins or anything. But the other is when your body realizes it's been invaded or there's something different in it. It reacts by causing what we call inflammation. And sometimes that inflammatory response, which is your body's ability and mechanism to fight a foreign invader, can be ramped up so much that your body starts to suffer from it and your organs start to suffer from it. So the disease that COVID is producing is partly from A, the coronavirus itself, and B, the varying degrees of response that different individuals are mounting in response to the COVID to try and fight it. And sometimes that may overpower your lungs, it might overpower your heart. It may make you to start to have small blood clots in little vessels, which start to damage other organs and lead to a different situation, which is why sometimes they put these patients on heparin and other blood thinners. Furthermore, like Sister May said, COVID virus has been around with us for a long time, different strains. And what happens when you have viruses like that, a big family of viruses, is that when two different strains co-inhabit in the same organism, sometimes they gain some genetic material, what we call RNA. And when they gain those material, because they are in different individuals, it allows them to mutate and change a little bit. And sometimes those mutations work in our favor. It reduces their ability to be virulent. It reduces their ability to be transmittable. It reduces their ability to make you sick. But like we're seeing in the Indian strain and the UK strain and the West African strain, sometimes those mutations cause the spike proteins to change. Now, what are spike proteins? Spike proteins are adhesions They are the things that stick out from the core of the virus that allows it to attach and then invade into the cells in the body. And so sometimes they undergo transformation because of gain or lost genetic material that makes it easier for them to get into those cells and wreak havoc within the cells. So why is this talk we're having today important? Because the more people are vaccinated, the more we are strong and we're getting to herd immunity, then the less these viruses can find posts that they can dwell in, they can multiply in, and potentially change and cause another increased infectivity or transmissibility. So we are fortunate to be where we are here today in the sense that we have 3 good vaccines that are being approved by the FDA in the United States of America. I know we'll talk a little bit more about it, but these vaccines came quickly because of the advances in science. And I'll give you a little bit of example so you understand what I mean. In the good old days, when we want to offer people immunity or we want to help people fight infections, we can either get the virus, culture it in eggs or other cell tissue, get out the virus and try to mutate it or change it so that it's less infective, which is what we call inactivated live vaccines like, MMR and things like that. And so when we've cultured it and we've mutated it and we've dealt with it over a series of time, then it's ready for testing, then it's ready for vaccination. Or sometimes we use a killed vaccine. We get the virus, we kill it, we prepare it, and then we inject it. And your body says, hey, I see a rubber over there. And it forms antibody to it. So when the real virus comes into your system, your body remembers, I've seen you before, I've dealt with you before. These are the T cells that I used to deal with you. Go and attack. So your body ramps up response and is able to attack it. Over the last decade and a half, scientists have discovered what we call messenger RNAs, which are a group of proteins that are used for replication of viruses. Certain viruses are RNA viruses, certain viruses are DNA viruses. And without having to go into too much of the technicality, those are just the blueprint that says, hey, okay, go, your eyes are going to be blue, or your eyes are going to be brown, or you're going to be 6 foot tall. They are the genetic material that code for these things. So they've been able to discover messenger RNAs that allow these viruses to be able to replicate themselves and grow. And so since we already have these synthetic messenger RNAs, once they were able to identify the COVID virus, it was easy for them to move quickly to getting possible candidates for vaccination because they could use these synthetic messenger RNAs and target it to what they thought was the most important part of the virus, which is the spikes and the adhesion molecules. So what they do is use this synthetic to be able to create a genetic code that can tell your body to produce those proteins. And so once your body produces your proteins, then your body turns around and says, hey, by the way, you shouldn't be here. So I'm going to fight you. And so your body revs up the immune system to learn to deal with those proteins. And so that's why when you get the vaccination, sometimes you feel a little sick, you feel a little fever. That is from your body revving up to go and attack those proteins. And then they sit back and they rest. Then when you're truly invaded by the virus, your body says, I've met you before, I've dealt with you before, and this time around, I'm going to increase my antibodies tenfold to be able to arrest this development. And so that's why we're here today talking about vaccination and how we can move forward and better, protect ourselves and give information and answer questions. Thank you.
Is Dr. Oge preaching? Was that a little preaching coming out of Dr. Oge? Come on. Okay. It's offering time, Dr.
No, it's interesting though, Dr. Oge. That was one of the questions that really, when you were talking, first thing that popped in my head was, why is it that sometimes, especially people that have gotten the 2-dose vaccines, some people have felt like, minor, symptoms like you had described. Why was that? That's some people don't know or didn't understand. If I'm getting this vaccine, why am I feeling like I'm getting a little sick and I don't want to get sick? And some people are even thinking about, I don't know if I want to go through all that. and not understanding if that is something that is normal or should be normal. So it was really good that you gave some clarity and understanding as to why that may happen and the purpose behind it. You know, like you said, purpose, you know, what is it? Purpose not known.
Where purpose is not
What
known.
purpose is not known, abuse is inevitable.
Yeah. So I think it's good because Dr. May started us out by sharing, taking us back to the whole, focus of COVID. And then Dr. Oge, you added in, which I think is good, of really beginning to talk about the vaccine, with COVID and then the vaccine and why your body may respond the way some experience it. It's a hit or miss. Some, when we got the vaccine, I didn't have any symptoms, first, except a little soreness in the arm, but I didn't have any symptoms. Pastor Aisha said, she felt a little bit tired, from this, but, I think it's a hit or miss. But the point I think that you made.
But all of our boys had all those minor symptoms.
Yeah, they had minor symptoms. They're not as strong as their dad. They're not as strong as their dad, but they had minor symptoms. But it's the point that you made, which I think is so your body is, that's a good thing, that your body responding, revving up. As you said, to go say, I've met you before. Come on, Dr. Oge. All right. So
it sounds like an Avengers movie.
Yes, yes, that's good. Dr. Oge is Captain America. That's who he is. That's good. Nurse Nicole, did you want to add anything into that before we move? I don't want to assume. Anything you wanted to add in?
No, everything has been wonderful. And I think that's why I had I didn't have any reaction to my vaccination because I had COVID myself back in June. And then I got my vaccination back in February. And I think I didn't have any side effects because I already had been exposed. So my body was already ready to, mount up the more defense. I had more troops on board to keep me protected as I'm out here taking care of other people. So yeah, wonderful illustrations, wonderful history. So we're anxious for those questions so we can give you the accurate information.
That's awesome. And, again, as Dr. Oge said about Dr. May, I think it's so awesome that in spite of where you've come from and with your precious mom, who's now with the Lord, she's good now, but to be able to show the seriousness of it. Your mom was good until, that even though she had different challenges, she was fine and could have been prevented, prevented. Just people didn't know, just didn't know and didn't have the information. So thank you for your transparency and sharing that. All right, let's dive in because now let's kind of transition now and go full throttle after. That's my new nickname for you, Captain America. I'm gonna start calling you Captain America. That's my new. I feel fired up, Dr. Okay. But that there's so many people that there's so much false information about the vaccine. The problem with our society, we can get all the information we want to get, but the problem is it's not always accurate. And that's why Pastor Aisha and I are so appreciative to have the three of you medical professionals who can really help reinforce reality, accuracy versus myth. And I want us to spend some time before we then go into some Q&A. So if you're watching, you have a question, we're going to try to do some Q&A. I think it's most important for these doctors and Nurse Nicole to share their wisdom, but we will see. We're not going to go long, so I want to let them get the information out, and then we'll see if we can do some Q&A. But there's a lot of myths that I want us to dispose of because, again, we're getting ready to offer the vaccine. Others have offered it, great, but there may be people watching tonight that, they go to Victory, they live across the street from Victory, within a drive to Victory, and they're on the fence about it. And they just don't know because they heard something that was said on TV that they didn't hear the whole thing, or something that somebody else said, or, somebody else had a bad experience, or whatever the case is. And I really want to help to kind of bring clarity to that, to help ease people, give them information so then they can make whatever decision they feel is best for them. And so let's kind of walk through it. Number one, and Dr. Oge, you kind of hit it. I think I want us to kind of talk about it a little more. The vaccines, some people feel the vaccines aren't safe because they were developed so quickly. That we've heard that before it took years for them to develop vaccines, and they did this in a short period of time. So there's a thinking that I'm not putting that in my system. They did that too quick, and it may not be safe. Can we elaborate on that, kind of address that? I don't know who wants to go first, Dr. Oge, Dr. May, whoever. Will just kind of, let's respond to that.
So I'll take a first grab at it, and then my sister can join on, and then Nicole can join as well. Science has really advanced over the past decade and a half, 2 decades, especially with the discovery of messenger RNAs and even microRNAs. I don't want to go in depth into the whole genetic, how replication occurs. But like I alluded to previously, in the olden days when we're exposed to viruses that, cause pandemic or cause severe infection, we first needed to go and culture those viruses and then try to see what we can do with them, see if we can make them weak or ineffective, or see if the dead form of the viruses will be applicable before we can go testing. But now that we're able to use messenger RNAs to identify different aspects of these viruses. So remember, we are not creating the entire virus, because I know one of the things people are worried about is that we're trying to recreate the virus and put it in humans as vaccination. We are not recreating the whole virus. They are targeting certain parts of the virus that they want to expose to your body and expose to your cells so that your body can then produce what it's going to use to fight it and then produce what we call memory cells. Those memory cells are what will stay in your system, and on second or third exposure, they'll be revved up to go and fight. So with the discovery of messenger RNAs, for some time now, people have actually been trying to use messenger RNAs to create vaccines. This is not the first time they've tried it. They tried it with Ebola, but unfortunately they were not successful. The current vaccines we're using were working, so there was no actual intention to try and switch what we have that's been proven and tested. But then COVID came around and it was the ideal opportunity to be able to target this spike protein. And thank God it worked. Sometimes we go around praying for favor, and when favor is staring us in the face, we fail to recognize it. Now, the other aspect of what people do is by creating vaccines by what we call a vector. What is a vector? A vector is something that carries a commodity or an item from one spot to the other. And some of the vectors we have are viruses like adenovirus. What they do is they can take a certain portion of RNA or DNA and they can go and insert it in a known virus and then change the mutation or the makeup of the virus to be able to allow the virus become weaker. So when they use it for vaccinations, you can use your body to rev up your system to be able to protect you. The J&J vaccine, on the other hand, is a product of a vector vaccine targeted towards the same spike protein, unlike the Moderna and Pfizer, which are actual messenger RNA vaccines. And because of the knowledge and the breakthrough with messenger RNAs, they could quickly ramp up this production. They didn't need to go through culturing the cells in eggs, in sheep, in pigs or whatever. They didn't need to test to see what kind of deactivated or weakened virus will work. They just needed to take the virus, look at the RNA, look at the genetic makeup, and create a messenger RNA that could replicate the protein portion that adheres to the adhesion molecule. And this is really breakthrough for science.
That's really good. That's really good. That, when you're talking about the messenger RNA, it's really good, which it makes sense. I appreciate you drilling it down to layman's term, because I know you could go real deep, and I appreciate you drilling it down, but that makes sense as to why a lot of time would be cut out. That's really good. Dr. May, did you want to add anything in to that?
The only thing is, I know, and I don't know if you guys remember, a few years ago, they also had another SARS infection. So they already had some research from that one. So they weren't starting at ground zero for this vaccine. They had a lot going on already before they started.
That's good. That's good. So yeah, so it wasn't like they just started and did it in 9 months. It was ahead of time that they did. But I know the messenger RNA made a big difference. It helped them, move further along. Nurse Nicole, anything else to add in on that? Okay. All right. Another myth. So that's really good. That helps debunk the myth of, well, something's wrong because they did it real quick. So that, I just appreciate you clearing that up. Sometimes people think that, or there's something out there that vaccines can lead to long-term effects, that I get the vaccine. And some people don't want to get the vaccine because I think they're expecting that, I'm just going to watch because 3 years from now, 4 years from now, there's some long-term negative effects that are going to come out of that. Could you address that? Because people are very concerned about that, that there's some long-term negative effects that can come out of it. So I'm not going to get the vaccine because of that. So anybody can jump in. Anybody? Go ahead, Dr. May. I think I saw you unmute yourself.
And as far as, right now we have not seen any of that. And the CDC, and I meant to mention, you probably heard CDC. CDC is Centers for Disease Control. And the job of the Centers for Disease Control basically is through the nation to try to make sure, that we prevent disease. We try to prevent it from spreading. We try to protect the whole community. So they've been doing the research, been following patients, and most of us that are got the vaccine, we've been actually they've been checking in with us every week to see how we're doing. And they did all that with the studies. They have not seen any long-term effects. I know our hospital has given over 65,000 vaccines out. We have not seen anything long-term. We've seen very minor effects. Even some elderlies that were really sick, some of them, we'll admit you see how you're doing, but the next day they're like, okay, I'm ready to go home, I'm fine. So they are studying, they are following, and most of us, when you get your vaccine, they ask you to register so that they will check up on you so that you can plug in your symptoms. First, they start checking you daily, then they start checking in weekly and even 6 weeks later to see. So they're following people to make sure that there's no long-term effects.
Very good. Very good. Anybody else want to add into that at all before we move forward?
I just want to encourage people to, when they send you that information, please respond, because it helps us get the best data so we can get this information out to you and get everyone protected. So if the health department reaches out to you or you sign up, please sign up for it. Let them know so we can all be informed.
That's very good. Very good. Dr. Oge.
Yeah, in addition to the information my sister shared, I was very confident being one of the first few people to get the vaccination when it first came out, because realizing how it was made and generated, knowing that they use synthetic mRNAs that are not going to hang around in my body for much longer, and they're going to be producing proteins that my body is then going to fight and then calm down. That gave me confidence that the chances of having long-term side effects for it were low, which was why I was happy to be one of the poster children for this noble act. So it's safe. The CDC is studying it. How do I know they're studying it? When they released the J&J and we had 6 people out of 7 million have blood clots, they picked it up. That tells me that someone's watching, someone is taking this seriously, that people are not just experimenting with our lives, and that if something was to come up, it will be studied. We'll look for the association, and then we'll try to get a hand on it. We need to understand that these vaccinations and the efficacy, the Moderna and Pfizer, 94, 95%, helps us a lot. It might not stop us from having infection, but it improves our chances of surviving the infection. If we would have died from infection, maybe we'll be a little sick or we'll be sick. If we would have been a little sick, maybe we'll be asymptomatic. So in medicine, we try to look at risks and benefits and try to balance things out while looking at the science behind it and trying to see if the science is sound. And from what we've discussed, the science seems to be sound and seems to lean towards us not having permanent disabilities or injuries from it. But CDC is gathering information and we'll get to know more if there's anything else to know.
I just want to personally say that I was very proud when I was watching the news and to see you, Dr. Oke, is one of the first doctors in Pennsylvania to have gotten a shot. I said, oh, that's one of our doctors.
I was like, he looks familiar. Where do we know him from?
I was so proud, but
Yes.
I thank you for doing that and being an example. And I think that was one of the reasons that even Bishop and I did it. For some reason, we didn't think probably we were going to be able to get it until like maybe March or April, or even around now. And when we had the opportunity, when we got a call saying that we could get it back in, what was that, end of January or February, that we were able to get it. I'm like, should we do it? Part of me wanted to wait to see what happened with other people at first, but I'm like, no, we have to be an example, and a representative, to other people, to show.
And if Captain America can do it, then I can do it too. So no, that's good. No, I think that's very, very good. This is so good because I think this is giving people good information to process and think about. There's something else that's out there that people feel like you can get COVID from the vaccine. And Dr. Oge, you addressed that a little bit. Can we go a little bit further on that? Because people are like, they're thinking, well, they're taking COVID and putting it in my body. That's a kind of a mentality, or I can get the virus. I get the vaccine, and now I'm going to get the virus. Like some people are equating that, sometimes they put the flu in you for the flu shot, and people are equating it that way. Can you expound on the difference on this?
Can you also, in addition to that, some people think that once you get the vaccine that you can't get COVID. Can you explain that as well? After you get the vaccine, are you still able to contract COVID?
Yeah, so let's first talk about that. People feel like they're going to get COVID from the vaccine. That they're going to put the vaccine in me, then I'm going to get COVID. And then also, if you guys could address the fact that some people feel like, well, when I get the vaccine, does that mean I can't get COVID? So can you, let's address those two.
Okay, I'll take a first stab at it. So it's not possible for you to get COVID from the vaccine. Like I mentioned, there are two different types of vaccines. There are those that are built based on messenger RNA technology, and then there's the J&J, which is built from the vector technology. The messenger RNA technology breaks down into the Pfizer and the Moderna vaccines. And all these vaccines are based on replicating parts of the virus. The major part that's been targeted is the adhesion molecule, the spikes we're talking about, which are important for the virus to fasten onto the cells and be able to make it into the cell. And the faster they can make it in, or the less inhibition they have in getting in, the more the transmissibility and the effectivity of the virus. So the vaccine is not in any way a whole COVID virus. It is a synthetic production that's allowed to produce the proteins related to this molecule so that your body can be sensitized and exposed to it and be ready for battle should you be exposed again. Now, the second question, which is a very important question, thank you, Pastor, for asking that question. If I have the vaccine, can I get infected? And the answer is yes, but it's not a straightforward yes. Just like if you say, if I got COVID the first time, can I get COVID again? And I'll tell you, my kid brother in United Kingdom got COVID twice. The first time he was very sick. The second time he wasn't that bad, but he was pretty sick because there was a new strain around. So we talked about the ability of the virus to make it into your body, make it into your cells and cause disease. And we talked about sometimes when you have two different strains of coronavirus in a person, they sometimes borrow genetic material, which is what allows different parts of your body to be what they are. And sometimes that material might make the adhesion molecules, the spikes, to change, or make the core to change, or make the speed at which they get into the cells a little faster so that people get sicker or it gets transmitted a lot faster. And so with those changes, you can have a virus change slightly or change the adhesion molecule slightly so that your antibody will not fully identify it on time. So what we do know for sure is that once you're vaccinated, your body has memory to the spike proteins and things we've talked about, especially to the particular strain that you were vaccinated against. As you start to have slightly different changes, when they come in initially, it might not be as easy for your body to quickly identify those adhesion molecules. So sometimes you might start to react to it, and then your body says, oh no, I've seen parts of you before. Oh no, I know how to deal with you. And then your body goes into rev up mode and starts to fight. The beauty of the Pfizer and the Moderna studies showed that, when you get the vaccination, it could make you have a mild infection, or you could be exposed and be asymptomatic because your body is taking care of it and doing what it needs to do. But at the same time, you still have to make sure you're practicing appropriate hand hygiene and you're doing the right things to make sure that all those around you, because if people are not vaccinated around you, you want to.
All right, so Dr. Oge froze up, so so Dr. May, did you want to add in? Did you want to add in? Oh,
Oh,
there you
he
go.
is.
Dr. Oge, you froze up a little bit.
Just for a second.
You froze up on the part when you were saying that, with the vaccine, you want to have proper hygiene because you don't want to give it to those around you. And then you froze at that point.
Yeah. So with the vaccine, it can make you asymptomatic, but you want to make sure you're practicing proper hand hygiene and you're doing the right things to protect the people around you, because we know not everybody is vaccinated. And I don't know if you got this part where I said the vaccine would not give you the infection because no one is giving you the whole virus or a potent virus. They're trying to give you different parts.
Yes, that's good. That's good. Dr. May, did you want to add anything to that?
Yeah, only the one thing, the fact that you can still, there's a very small chance of getting the virus, of course. And the most important thing is you're not going to die from it, and you're less likely to be on ventilators. Because some of my patients say, well, why should I get it? If I'm still going to possibly get the virus. Well, but if you get the virus, but you're not in the hospital and you're not dying from it, that's a whole lot better.
Yeah. I've heard people even say, well, I'm not getting it because I don't know what they're putting in my body. And a train of thought response to that is, well, if you get COVID and you can't breathe at the hospital, you don't know what they're putting in your body, but you're not going to care because you want to breathe. So, there's different trains of thought that we just have to balance, out. But I think you guys are just giving some great information. Nurse Nicole, did you want to add anything to anything that was said so far? Or in that, I just want to I'm always including you. I want to make sure. I don't want to assume. So, okay. Very, very, very good. What about the whole mentality? I've already gotten COVID, so I don't need to get the vaccine. I've gotten it. I've gotten the virus, so I don't need to get the vaccine.
And with that, some people feel that haven't their body already built up antibodies, so do they still need to get the vaccine?
So I got COVID already. I got through it. My body, now it's antibodies. Why do I need to get the vaccine? Do I need to get the vaccine? So can you expound on that? To that mentality that I got COVID, I don't think I need to get it because I got it already and I got antibodies, so I probably don't need to get the vaccine.
I mean, well, we do know that you can get it again. And so, of course, if you can prevent from getting it again, you're definitely much better off. And the other thing, and what was your other question?
Was it was what was it?
Hasn't your body already built up antibodies?
Yes.
That would make the vaccine unnecessary.
Right. Yes.
So they definitely in the studies found out that you get much better protection from the vaccine than you do from just getting the virus. So you're getting a whole lot better protection from the vaccine. So definitely, if you want the best protection, the virus alone is not enough. You definitely want to get the vaccine.
And I Dr. Oge, did you want to add into that? Anybody else want to add in? I'm saying that because I don't want to assume that you guys don't want to add or whatever.
She hit the nail on the head beautifully. I cannot add or subtract.
So I have Captain America and Wonder Woman. That's what I have. Nurse Nicole, anything? Nurse Nicole, anything to add on that?
I really wanted to be vaccinated after having COVID in the summer because I wanted to be protected from the variants. Every few weeks there was a new variant coming out there, and I want the army of my antibodies and my defense ready and waiting for anything that could come, in the doors of my hospital. I take care of a lot of ill people, so I don't know what I'm being exposed to, but I wanted the extra protection from the variants as well as the different mutations of the virus. It's a lot we didn't know, and I just want to be protected all the way around.
And that is another question that some people are asking. How do we know that the vaccines that are out there are covering all the different strains that are coming out?
I mean, they have, we don't have, of course, complete information on all of it, but they are showing that right now, a lot of the strains are the similar spike protein. They are still getting a response. So, and of course, they're going to constantly study that, but we are showing it's the same spike protein. So, so you should still get coverage for those variants, but studies are always going to be ongoing.
Okay.
Okay, very good. All right, anybody else? We're good? All right. I want to kind of combine two things on this, that there's another thinking that people with suppressed immune systems shouldn't get vaccinated, as well as underlying conditions. People that have underlying conditions shouldn't get vaccinated. So I have an underlying health condition or I have a suppressed immune system, I shouldn't get the vaccine because it can hurt me. Can you address that?
And can I just, somebody actually expounded on that question, because we knew that we were going to address that question. And I just want to, somebody actually asked a question, and you may want to lump this into answering that question. And they said, what if your immune is already weakened? Will getting the vaccine hurt? Should you wait until your WBC levels are checked? What if your doctor has not controlled your asthma, heart, chemo, patient's autoimmune disease? Will you have enough or strong mRNAs or T cells to help you fight the vaccine? People should know their health before taking vaccine. If you haven't seen a doctor in years, that get a physical first before the vaccine. That was what they were saying. So maybe address.
I think that ties in. So that ties in about, just suppressed underlying health conditions or a suppressed immune system. So can you guys elaborate on that briefly on that?
As far as the underlying conditions make you more likely to die from COVID. So bottom line. So you're better off getting the vaccine than getting COVID. Now, as far as specific conditions, as far as being immunosuppressed, for the most part, the studies show that you will get a response. Will your response be a little weaker? It might be, but it still will be a better response than nothing. But we always say, if you are under specific, you're on specific medicines, you definitely want to talk to your doctor before you go, especially if you're immunosuppressed. But for the most part, the only real contraindication or a reason that we would say do not get a vaccine, if you have had an actual allergic reaction, meaning you had hives to a shot. All right, you had hives, shortness of breath, or throat swelling to a shot, not to a medicine. You can have food allergies, you can have medicine allergies. That will not make you high risk for having problems with getting the vaccine. But now, if you've had problems where you had an allergic reaction, severe allergic reaction to shot, then you want to talk to your doctor before. But for the most part, everybody else, you are better off protecting yourself, because those conditions make you more at risk of dying from COVID than it does getting a reaction to the shot.
Excellent. Excellent. Anybody else want to add in to that? All right. Very, very, very good. There's another thinking out there. Dr. Oge, you kind of expounded, but maybe just kind of reiterate in case people missed it early on, that the vaccine will alter your DNA. There's things that feel like it's going to alter your DNA. There's things out there that the vaccine is the mark of the beast. The vaccine is, a mind control. It's going to alter your DNA. Can you just expound on that? Because this is a real way of thinking. People hear it or whatever and don't know if that's true. And I want them to hear from a medical professionals just on that.
The vaccine is made up of synthetic messenger RNA, or in the case of the J&J, a vector, which allows you to build a protein. It by no means or no chance has any effect or binding to your DNA to alter your DNA or change your genetic makeup. So that will be categorically false. I know people would think about these things because whenever we're talking about DNA, RNA, virus, genetic material, people start to think and wonder what next, or could someone be doing something in guise of something else? That would not be in this case, or in the case of this vaccine. The vaccine is not designed or targeted for that purpose. This is just to help you build some immunity and awareness of the virus spike protein, and to help you rev up your immune system when the time is needed.
Excellent. Excellent. Anybody else want to add in to that? Excellent. You know, one of the things on that vein, you know, people from a Christianity perspective, you know, people have, you know, I've heard over the last year and heard people say it's the mark of the beast. You know, this is the mark of the beast. And I'm like, you know, walk through scripture on that. You know, if it was the mark of the beast, they would not be doing it secretly, because the mark of the beast, you have to, it's an open, you know what it is, and it is an open oath to a man. It's something that you choose to do. It's not something they force upon you, because the Antichrist wants to mimic Christ, but the opposite. And so it's not where, oh, you got the mark of the beast now. The mark of the beast, when that time comes, if you're here, then that is more of you openly know this is the mark and I take an oath. It's not behind the scenes interjected into your system. But this is real thinking, which is why I appreciate sharing tonight, because people they hear things and get exposed to things, and then that becomes their reality, and it could be wrong, but they're making decisions out of false information. So a couple other things that if you get vaccinated, it can make you infertile. People think that it's going to make me infertile and I won't be able to have children or whatever the case is. Can somebody address that of just that thinking at all, or that you know, a response to that? People thinking, well, I could get infertile, so I don't want to get the vaccine in my body.
We have not seen any of those possibilities. And actually, most of the OBGYNs are even recommending that if you're pregnant, you get it, because you're more likely to do worse if you're pregnant. So definitely right now we haven't seen any reactions. We're better off protecting your maternal ability right now by keeping you not sick.
That's good. That's good. Anybody else want to respond or add into that at all? Okay, that's very good. What about I mean, in that lane, same thing. If I'm pregnant or breastfeeding, you know, I definitely shouldn't get the vaccine. That's another way of thinking. So I'm pregnant or I'm breastfeeding, so I'm not going to get the vaccine. Just what advice, or how do you advise somebody on that?
Same thing right now, as far as we haven't seen, any reactions. And we always tell you, when you're pregnant, always ask your doctor before you do anything. But we have not seen anything saying that it's a problem. You're protecting that baby.
Awesome. Dr. Oge, were you going to, it seemed like you were saying something, if you were expounding on something.
Once again, she hit the nail on the head. Pregnancy is pretty high risk. And one of the things that I want people to understand is that as that baby is growing in you, by the time you get to 6, 7, 8 months, it starts to push up on your diaphragm, which makes breathing a little bit trickier. So you find that pregnant women might breathe shallow, but a little faster to be able to get oxygen in. And if at any point in time during that period, you then start getting a respiratory infection, it can make matters twice as bad for you. And with all the anxiety and fear that was involved during the heat of the pandemic, pregnant women were scared to go to the hospital for their necessary treatment or to be checked if they're in labor, because they didn't want to be told they had COVID. So by the time a lot of pregnant women were arriving at the hospital, unfortunately, their children were in trouble, because if you have breathing problems and you can't maintain your oxygen, then your baby is not getting enough oxygen, because your baby is getting some of your oxygen. So unfortunately, as a neonatologist, a baby doctor, we were seeing a lot of babies that were getting into trouble because their moms were scared to go to the hospital, or their moms were so sick, or some women immediately after they deliver, they get very, very sick. And so their children have to be transferred to the ICU. So I know most of the OBs right now are recommending their patients get the vaccination. A lot of my colleagues that are pregnant or just had children have had the vaccination. I've not seen anybody have any adverse event or share anything with me. And, again, this goes back to the color of favor, knowing what favor is. I think part of the reason why all of us are here today is because we work with colleagues that have gotten the vaccination, and we work with other patients that have gotten it, so we can see for ourselves and we can report in real time to our church community and to our friends that this is what's going out there, so that you don't just have to take CDC for it. You can at least trust us in this community.
That's good. That's very, very good. Nurse Nicole, do you want to add something into that? I mean, because I mean, that's kind of in your wheelhouse of any, that what you're saying. Can you want to expound anything on that?
Yes, I've had colleagues that were pregnant during this pandemic, and I just want to say to everyone, be in close contact with your provider, with your doctor. That's what they did. There was a lot of information they didn't know. We were learning as we went along, but they stayed in close concert with their doctor. Everybody's individual. They know your past medical history and your course. So as long as you stay in contact with your doctor, and pray about everything you're going to do too, so you know where to go and lead you to who you need to give you the accurate information. All of them did well. The babies turned out well, but one thing they had that they did was talk to a reliable source, got reliable information, and stayed in contact with their doctor and kept themselves as healthy as possible. So you really need to do that. Talk to your doctor and get accurate, trusted information from reliable sources, not these rumors. Get actual data that you can trace back for your well-being.
Yeah, and I think that's important. The Bible talks about doing the natural and the spiritual, and so many times we can be off balance. In what we're doing, we can be so natural, or we can be so spiritual. And I think it's good to have this information because I'm going to pray about it, but if you don't have accurate information, then you're praying biasly or off. So I just, again, so appreciate tonight. We have superheroes. We got a superhero nurse. We got Captain America. We got Wonder Woman. I really appreciate you guys taking your time out like you're doing to help give accurate information from a medical perspective, but yet at a drill down. Because we've all sat with doctors where they're talking and they're talking in these terms and we don't know what they're talking about. And you guys are really making it layman's. And so really, really appreciate that. Let's talk about, as we're wrapping up, and then we're going to just do some Q&A, that the mindset, and I think it's really walking right now. I know they're changing some of the guidelines, but at this point, sometimes people are like, okay, I get vaccinated, so I don't have to wear a mask at all. I don't have to do anything. And could you just reinforce why getting vaccinated is not the end all or be all? Dr. Oge, and I think Dr. May, you kind of hit it, but can you just reinforce that?
And can I just expound on that? Because a number of questions have come in asking if you're fully vaccinated and then you contract the virus, are you contagious? Or if you're vaccinated, can you be contagious to other people?
And I know we kind of talked about it, but I just want to isolate it for a moment, so I get the vaccine. And so, well, I don't have to wear a mask right now. I don't have to do this, that. And I'm not talking about how they're trying to adjust with the CDC, because I know things are changing. I'm just talking about the foundational premise. Like in New Jersey, we still have a mask mandate right now and social distancing. And people may go, well, I got vaccinated, I don't need to do that. Could you just kind of expound, and not coming against what anybody's saying. I'm just talking about the principle of it, of why we need to just be mindful of that.
So the most important reason why we're trying to get vaccinated is so that we have fewer people that are receptive to the virus, so that we reduce the risk of getting multiple strains, which would then potentially cause other infections. So the more people in the society, when we start talking about herd immunity and how we get to herd immunity, a certain percentage of the society, either having the vaccination or having been exposed to COVID itself, then we start to reduce the number of susceptible bodies and the emergence of difficult strains, which may be problematic. So because of this issue of new strains emerging, it becomes important to realize that even though you're vaccinated, you could still get the infection. But the good news is that so far, the vaccines we have been able to protect to a good degree the number of strains that are coming out. The good news is that the vaccines we have been able to reduce the intensity and severity of the disease that follows through. So do you want to have memory cells that are able to rev up and help you should you get exposed? Or do you want to go into an infection just blank without any previous knowledge of what you're going to have to deal with? So to sum it up, yes, if you're vaccinated, you can still get an infection, but the vaccine will give you some protection and allow your body to be better prepared. But because you're vaccinated does not mean that everybody around you is vaccinated. Because you're vaccinated doesn't mean that the strains that they have all around you are ones that you will take care of quickly and easily to the point where you're asymptomatic. So the fact that you have to wear masks is because you can only account for yourself, your household, and your family. You can't really account and speak for other people. And to that effect, you have to protect yourself, because by protecting yourself, you're not only protecting yourself, you're protecting your family, your loved ones. For me, I protect myself because of the people I come in contact with at church and when I'm serving, my family, my loved ones, my aged mother, then plus my patients, because I took an oath to first do no harm. So having been vaccinated, if I'm going to go to a place where I do not know if the people there are vaccinated and I cannot vouch for them, then the safer thing for me to do is wear a mask until we get to a point where the governor says, based on the statistics we have, we've achieved herd immunity because 70% have gotten their first shot, 50% have been exposed to some form of COVID and have antibodies. And so the risk of, having susceptible people in the community is lower, but not zero. We have to understand that you have to give to Caesar what is Caesar's. When the governor looks at the information, he has to think of economics. He has to think of taxes, raising money, how he's going to take care of the people of New Jersey, how he's going to fund the schools, how people are going to make money, and how people are going to in turn pay taxes to him. When we come to the church, the bishop and the pastor have to look at us and say, well, they are our shepherds, and they need to care for our emotional well-being, our mental and spiritual well-being, and they have to make informed decisions that allow them to care for us, both emotionally, mentally, and physically. And so the governor is going to do what he's going to get to a state of comfort where he can say the risk is below 10%. I need to open up so that restaurants can make more money, so that baseball can make more money. They in turn can pay their taxes. We can start to come out from the red to the black. And those decisions are going to be pulled in different ways compared to other decisions that are made in different places where we're looking at our risk of exposure, the number of susceptible human beings that are out there that might get the virus and in turn expose me, who is vaccinated, and then I potentially get sick.
No, that's good. And that's good. And I think that's why having this medical advisory board with you, Dr. Ogay, Dr. May, Nicole, Dr. Robin, a few other medical professionals, it's important so that we're not just making a decision off of the government, because we know there's different motives there, but we're drilling that down as well. And that's very liberating for Pastor Aisha and I, because whenever we stand before the church and go, this is what we're doing, we want to say, in conjunction with having gotten advice from our medical professionals who are at Victory, so they know the culture. So I think that's very good, very good. All right, just I want to start. We're running out of time. I want to just take a few questions. Did anybody want to add anything into what Dr. Ogay said? I don't want to assume. Make sure that we're good. Okay, so
I want to. There's one question that's come up multiple times, and I don't know if you guys can answer this, but they're asking about the booster shot and if they have to get that every year. That's a question that everybody's asking.
So we don't know if you know the answer, but let's hear from you. So the booster shot, what's your thoughts, or what are you, what you understand?
They're asking, is it true that you have to get a booster shot?
Like the flu shot, I guess, like the flu shot or something. What does Captain America and Wonder Woman and our superstar nurse say?
I know that Pfizer has already alluded to the potential that there might be need for booster shots. Like my sister, Dr. May said, we're still collecting a lot of information. The CDC is collecting information. Like Sister Nicole said, when they send you that information, log in and drop the information over there. We'll continue to study the strains that come out. They'll continue to look at those things in the lab. They'll continue to look at how the spike proteins are changing, how the adhesion molecules are changing. And if they change significantly from year to year, then the next thing to do will be to go ahead and probably give a booster shot that will care for the predominant strain for that year. They are not going to try to account for all the strains, but they're going to look at it in terms of transmissibility, in fact, how sick it can make you, and then account for that on a yearly basis. If you ask me to speculate, I would speculate that yes, maybe in 18 months or so, we might see booster shots coming down the spike. But for right now, there doesn't seem to be a need for it. The good news is that they continue to collect information, and the scientists will act when they have enough sufficient information that says now is the time to move.
Very good.
Can I add on to that? Because somebody asked a question. They said, my sister-in-law got the J&J vaccine. If 6 to 9 months after protection decreases, should they possibly switch to get the Pfizer?
So before we do that, did anybody want to add in to what Dr. Oge said? Does anybody want to add anything into that? And if not, then we can go. I just don't want to assume. So about the booster, any thoughts on the booster?
I mean, people shouldn't fear booster shots or worry about that. If you think about it, if we could go back a few generations, I mean, people generations ago died from all kinds of smallpox and polio, and more people died from flu before we had the vaccines. Now we have, people don't die from those things anymore because they get booster shots. So, we shouldn't be scared of booster shots. They have definitely have us live longer and live healthier.
Very good. What about with past life? Just somebody ask that question again, because I think that's good.
My sister-in-law got the J&J vaccine. If 6 to 9 months after protection decreases, should they switch to the Pfizer?
So thoughts on how do we respond to a question like that? They got the J&J.
I guess they're told that in 6 to 9 months, the protection will decrease. So should they look to go and get the Pfizer after that?
So we'd like to base our answers here based on science. I do not know of any literature or research that has gone into that would show that if you get one, you should switch over to the other and to add protection or not. I think for right now, what we should be doing is to try and get as many people as possible vaccinated, based on hearing the information and making their own personal decision. And as time goes on, and we collect more information on the J&J and how people are responding to it and how the immunity lasts, because time will tell whether it's 6 months, 9 months, or longer immunity. Time will tell if the J&J maybe needs a higher dose to be able to achieve the same immunity. But that's information that is not available to us, and we don't want to speculate. So what we are here to give you today is based scientific research and knowledge. And when that information becomes available, we'll be sure to share that. I'm not aware of any information to that. The important thing is that the sister-in-law is vaccinated. We are grateful to that. They're doing their part for the society and for us all. We'll take it for now and we'll update on the later parts.
Yeah, and I think but that's the whole point of as many people getting vaccinated, because like the flu, you hit herd immunity at some point, and it changed the whole dynamic and took away the power, the destructive power of it. And it's the same thing that as we can, like Jersey has hit, they just released 70%, of Jerseyans have received their first dose. And that is herd immunity based upon CDC. Now that's the first dose, still got to get the second, but when we're the fourth state to do that. And when you do that, it changes the dynamics of it. So the more people that will be comfortable getting the vaccine, the better we are, overall. Anybody else want to add in? We have a couple more questions. And okay, somebody said, they asked, my wife is now sick, COVID patient now. She had the first dose of, it says BioNTech vaccine. BioNTech vaccine. Her appointment for her second dose is tomorrow. Active patient, would it be useful to have a vaccination? So I think that goes to that's something that mixing, you won't be able to cross over and mix whatever that BioN vaccination is. I don't know what
but he's asking about her second vaccine.
Well, her second dose is tomorrow.
Yes.
Would it be useful to have a vaccination? I don't know.
He's probably asking about should she get her second dose?
Well, basically, you do want to get your second dose, even if you had it in between, but you do have to finish your quarantine. So she has to finish her quarantine before she gets the second dose. So definitely she wants to talk to her doctor about that. But she does want to finish her quarantine, but definitely still wants to get her second shot.
Yeah, that was a question that somebody had put on Facebook too. Should they've tested positive and having symptoms, should they wait until they're better and have a negative before getting the vaccine?
Very good.
Let me address the negative part though. So the CDC, we are not doing confirmatory negative testing anymore.
Okay.
So you do not have to be retested. You just have to finish your quarantine, and the doctor would basically, you do need to talk to your doctor to find out exactly how long your quarantine has to be based on your symptoms and when you got the symptoms started. So we're not recommend waiting for negative testing. We have found out that people can be positive forever and a day. Sorry, more like up to 6 weeks. Yeah. But they actually found out that after 10 to 14 days of quarantine, or, after your symptoms are gone and you don't have a fever, you have like a 1% chance of actually being shedding virus. So you definitely need to be in contact with your doctor to find out when your quarantine ends, but you do not need to do the retesting.
Okay.
Very good. Someone asked, if I feel sick now with a cold, I think I just want to make sure it's the right answer. If I feel sick now with a cold, I've been tested, not COVID, should I get the vaccine now or should I wait until I feel better? So what would be an answer for that for them?
I mean, if they're definitely negative, they can actually get it. The only thing that prevents you from getting a vaccine, if you have a fever above 100.5. So if you've had a fever over 100.5 within the last day or two, then no, it's not going to work. But if you tested negative, you don't have a fever, get your shot before you get something else.
Okay, that's good. That's good. Couple other questions. So I'm glad you answered that. Someone said, so if you're a perfectly healthy adult, is it necessary to get the vaccination? Perfectly healthy, I have no issues as a medical doctor, and we've kind of dealt with it. But
like Bishop never gets sick.
Yeah, I walk in divine health. I've never had a cavity. I don't really get sick. I don't really get a headache. I got the vaccine. I've never had a flu shot. I've never had the flu, but how do you respond? Because I understand that I'm healthy.
He was questioning.
I don't get sick. I just don't get sick. Why should I get the vaccine?
COVID,
Captain America.
COVID does not respect man, woman, or anything. And
it's not a respecter person.
COVID doesn't respect it. Look, there are lots of rich people that have died alone in the hospital. If money could bring their family to them in their last minute, they would have paid for it. My mother-in-law, 83, had a fever, otherwise feeling well, went into the hospital, got tested, we thought it was a urinary tract infection, ended up being COVID. Fine, walked out. So COVID presents in so many ways. Some people just loss of smell. We are grateful to God that you're healthy. We are grateful to God that you're doing well now. But I will caution that the fact that you're doing well now does not mean that we can predict how you will handle the virus. The battle with COVID is not just what the virus does to you, but how aggressive your body's immune system responds to it, what we call inflammation. And sometimes you can rev up your inflammation so much that you're sick from that. So the fact that you're healthy might mean that you rev up your inflammation so much that you have what we call systemic inflammatory response disease. And that could lead you down a different pathway. So please, I would suggest you take COVID seriously. I would suggest you think about the multiple things we've said tonight. And I would still think that is very beneficial to you. Maybe not to you. Maybe you're healthy. Maybe you're asymptomatic. But maybe you spread it to your 80-year-old mom and she is not as healthy as you are. Then you have to live with that guilt because you could have taken the 2 shots. So please, 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 I would appeal to you to take this seriously, think about it, and look at it as your societal duty, not just to you, but to your loved ones and those around you.
Yes, that's
and
really.
I definitely agree with Dr. Oge, and I want to give you just a scenario because it shocked me. When this first happened, I had 4 patients on ventilators. 3 of them had really bad conditions, and I thought they were gone. One of them was healthy and was the caretaker of one of the other ones. The 3 with conditions all came out. The healthy one died.
Wow.
So you don't know.
It's not a respecter. It's no respecter of persons. There's a lot of people, a lot of healthy people that have now died, because of COVID. So, you had a question?
Yes. That is so true. One question, and you guys can, I actually have two important questions that need to come out. One person asked, my daughter is 12 and just had the flu shot. How long should she wait to get the COVID vaccine? How long should she wait before she gets the COVID vaccine for her?
2 weeks.
2 weeks. Okay. Okay. Now, this is a question I think definitely needs to be answered, especially since all of us, most of us, half of him is
All of
African American.
All of me.
And it's a question that a lot of African Americans have. They asked, can someone please explain the fear of getting the vaccine in relation to what happened to African Americans with the Tuskegee experiment, the injection of the syphilis virus and not given the vaccine?
And I think that's great because there's a lot of people that, that's a mindset. And we can't negate that. It's a mindset. So can you guys expound on that briefly? I think that's good, and we'll begin to wrap it up. But how do you respond to that? To that, just that reality of thinking.
I mean, definitely something to consider, and it's something that definitely happened. We cannot say that it did not happen. So one thing is, like Nicole was saying, is to have a trusted physician that you know. And I think you've gotten some trusted physicians today, and medical professionals that are talking to you and letting you know. And it's funny because we have a family Facebook group, and my cousin put in, you know what, it seems like all the Black people are getting Pfizer. And, I was able to respond to her. Well, guess what? All of the hospital, officials that got the vaccine first, we got Pfizer. So the Black people are doing pretty good. So as far as I've seen, I have not seen any discrimination. Pretty much as the vaccines are being rolled out, they're given to whoever wants them. I have not seen discrimination. But your best bet, if you have a trusted physician, is to always confide in your trusted physician.
That's really good. Dr. Oge, you want to add anything in?
Yeah, so our past always informs our future. And yes, a lot of crazy and, wicked, irresponsible things went on in the past, all in the name of research. And since then, the scientific environment and community has tried to learn from it by forming what we call institution review boards, and trying to make sure that there's informed consent and things like that. So when this research and things are going on, they try to make sure that the subjects or humans like us get all the information. Now, fortunately for us, the studies have already been done on the vaccine. The phase we're in now is the rollout phase and protection phase, whereby the CDC is also collecting data and trying to learn more about the effects of this vaccine, if any. So we've passed that phase where they can select and say, hey, there are two arms. I'm going to give the African Americans this shot that is going to hurt them or do this. And I'm going to give Caucasians and Hispanics another shot that's going to act differently. And I'm going to watch them and see how they react. If we're doing a phase 1 or phase 2 study, or we're still studying on different types of vaccine, that would be very possible. The phase we're in right now is that those studies have been completed in different races. And right now is the rollout phase, whereby the vaccinations are coming in ampoules and they're being injected to everybody that comes for the vaccination, whether you're, from whatever race you're in. So the chance and the risk for that is slim and close to non-existence. The part where you can control who gets what or randomize is phase 1, phase 2 trials. And we're no longer in study phase, we're in rollout phase because we had a pandemic. And when you have a pandemic, you have to deal with it drastically. And that's what has brought us here. So we're not randomizing, we're not choosing deliberately who gets what. You're going to get your vaccination on what is based on what is available, either at church next week when you come to church or at the hospital you go to. But the US through FDA has approved 3, which so far are working, and data is being collected, and we're getting good information from it. So I want to encourage everybody, and I want to allay some anxiety as much as possible. Yes, there is chance for research malpractice, but the phase we're in right now is not a research. Nobody is being randomized. we're all getting the final product post-research.
Very good. I mean, I think that's a great answer, dealing with the reality of a way of thinking, and rightfully so. That's a great. That's why it's good to have medical professionals on that can really bring some layman terms to that. You know, this has been really good tonight. I really appreciate you sharing. I'm so excited about next week, as Dr. Oge, aka Captain America, just responded. Next week we are, and I want you guys to answer, if you can just answer this as we're closing. You know, our church is hosting as a vaccination site one day from 10 to 2, the Pfizer vaccination. It's called Grateful for the Shot Sunday, partnering with the state of New Jersey. We're excited, where people can come in as they come to church or come from the community. They can come and get their first shot. We're going to have 3 weeks later with Pfizer, they'll be their second shot. They'll get their date that, you know, on next Sunday to come on, you know, 3 weeks later. And this has really helped, I think, people process. You know, next week, if people are interested, they can go to our website and get the information, click on the link, take them, because we want people to register. Registration is not required, but we want you to register, because right now we're going to be prepared to do at least 100 people.
www.victoryInChrist.cc.
That's my Vanna White. You see that?
I'm going to say it again, www.victoryInChrist.cc. So register to make sure even though you can walk in, we want to make sure that we have enough vaccines for everybody that wants them. So if you pre-register, that way we can make sure. But if people feel intimidated or they're not sure, you can walk in, but we just may not be able to guarantee that we have enough, but we possibly will.
So that's why we want people to register. Registration is not required. It is not required, but we want you to register for the sake of your fellow human, friend, your fellow person, a body of Christ, your fellow community person, so that God forbid you're the last one to get it simply because you didn't register. We want to make sure everybody, if you can, just go on our website, click on the link. Takes 3 seconds real quick to register. And that way they bring enough for everybody that's coming, and some for people that maybe are hearing about it at the last minute next week. But you'll be able to come in. It's free, doesn't cost you anything. Get your first dose. And then 3 weeks later, come back, same location to Victory, and get the seconds. For our partners, they can do it after service. They can do it between services. I've been saying, don't do it during service because I want to pastor you. But they can come whatever time your appointment is, you're going to do that. And it's going to be great. So I really want to make sure people know about it. I need everybody watching. We've had good turnout tonight. Spread the word. Let everybody know. Share our website.
Share this information. If you haven't done it already, share this on your page so that a lot of people that are on the fence can get this information and make an informed decision on whether or not they really should get this vaccination, because we want everybody to get protected. We want to build herd immunity as soon as possible. And so if they're questioning on the fence, or we want to make sure they at least have accurate information.
And so could you, and I'm not going to, because some questions we've already answered. And so if we didn't answer your question, if we answered all of them, people can go back and look at this to go back, because I don't want to ask you the same questions twice. But I do want you to, because someone asked, will one shot make you fully vaccinated? We know it won't. You have to get, if it's Pfizer, you have to get your booster. If it's Moderna, you have to get your booster. J&J is one shot and done. So, outside of J&J, you have to get you have to get your second shot. But could you just quickly share, because we're doing the Pfizer, could you share quickly what is the difference between Pfizer, Moderna, and J&J? Is there a difference? What's the difference? Just so people know, with us offering Pfizer, how is that different than Moderna and J&J? I don't know what's the easiest way to answer that.
So the Pfizer and the Moderna are the messenger RNA vaccines, and they have efficacy and effectiveness up in the 90s, 94, 95%. I think at one point about a month ago, the CDC was even touting that the Pfizer might be slightly higher than that in its effectiveness. But if you tell me that something has the ability of keeping me alive and giving me a good chance 9 out of 10 times, I'm taking it. I am taking it. The J&J, on the other hand, the initial reports, I think, was 67% effectiveness. But when you talk about effectiveness with the J&J, which is a one-shot, one-time deal, you have to understand that if you're saying that 7 out of 10 times, if I get this disease, I'm going to leave, I'm not going to die, I am going to take it. It's a game changer for me. Or if you tell me that if I take this thing, that 7 out of 10 times, I stop being the weakest link, I stop being the person in which a mutation can occur that can infect the next person, I am going to take it. So the Pfizer and the Moderna are 2-shot regimens. You get the first one, and then you get the second one that revs up your system and makes sure that your system can identify this protein. One is 4 weeks later, and then the other one is 3 weeks interval for it. And then the J&J is a one-time shot. My wife doesn't like needles. I'm sure I'm going to get in trouble for this. So she opted for the J&J. She waited and waited, and eventually she opted for the J&J. I was just happy she was getting anything, okay? At that point, I was dancing and dancing. She couldn't understand why I was happier than she was, but that's the reason why. So they're a little different in terms of how they were made. The Pfizer and the Moderna, like I said, are 2 shots each. I personally got the Pfizer. I had a little bit of soreness and fever, nothing else. My wife got the J&J. She was happy as a clam all through, no side effects, no problems. And so those are the subtle differences in both of them right now. I would personally put in a plug-in and plead that if you can't register, please do register. If for nothing else, for the effort that has gone through trying to get these questions answered and get this information out. And I'll tell you why. You don't want to show up and you're the number 101 person and we only have 100 shots. And we don't want to prepare for 100 vaccines and only 56 people show up. Why? Because there are countries that don't have this opportunity. We talk about favor and don't know what favor looks like. In West Africa, in Nigeria, where I'm from, they don't have this opportunity. So once we've taught this vaccine and then it goes to waste after a couple of days and you can't use it, that's someone else's opportunity we've lost. So please do us a favor. We've been gracious with our time under the guidance of our bishop and our pastor. Do us a favor in return. And please, if you can't register, if you can get a friend to register, have them register so that if we have 200 people, we are prepared to meet what they need so that we can eliminate as many weak links in the chain so that we can all be free and return to life as we used to know it.
Well said.
Can I ask you to expound on one last question? We are seeing a lot of people not coming back to get that second shot. Can you explain even more so the importance of why they should come back to get the second shot if they are getting the Moderna and the Pfizer? I don't know if people just think they're okay just getting the first shot, they don't need the second shot. Can you explain if it's okay just to get the first and they don't need the second, or the importance of getting that second? Because a lot of people aren't coming back to get the second shot.
Great question. So Dr. May, since Dr. Oge was just sharing, you want to share, Dr. May, and then Dr. Oge, if you want to share, and Nicole, anything you want to share. But and this will probably be the last question. Yes. Go for it.
I mean, you want that full 95% effectiveness, you have to get the second shot. You're not going to get as much effectiveness with the first shot. So if you want to get the full effect, you want the second shot. You're going to get some coverage with the first, but it's less. It's not the full package. So why get something and not get the full treatment and the full effect? Yeah.
Very good. Dr. Oge, anything to add into that? She hit it out the box. That's the sign. Nurse Nicole, anything?
The only thing I wanted to say was my mother, she had COVID. She had a complication from COVID and she has since passed away. My aunt, who's 78, got her Moderna shot. I got Moderna as well, but she got her Moderna shot. My mom was her caregiver and she got her Moderna shot on a Tuesday. My mom was diagnosed on Saturday and they lived together. My aunt, she never got COVID. She got her second shot. So you really need that second one because that was a concern for us that my aunt was not covered. And like I said, her primary caregiver, mom never got the COVID vaccine, but she was the primary caregiver and she got it. So you needed that second one because multiple people in my family had COVID when my mom did. My 4-year-old twin cousins had it. My aunt's grandson had it, her 30-year-old grandson, and my mom. So, and yes, that COVID shot really helped. The first one, she had some on board, but that second one, she was able to, avoid it. So yeah, you need that second shot. You really need that second shot to have that immunity. And my aunt is still here today, and she's fully covered, has not been sick, even though she was exposed to several people in her immediate family that were positive. So you really need, please get that second shot so you have that full immunity and have your body, fight this illness for you.
And like Dr. Oge said about Dr. May, in spite of the loss of, of your family, we appreciate all that you've done. We appreciate you. We couldn't afford for you to crawl in a corner and not do nothing. We needed you as essential superheroes, and we thank you for your service. Thank you so much, Nicole, for all that you've done and all that you're doing. You are a superhero, literally. Y'all want to know what a superhero looks like? Her name is Nicole. That's it. So as Dr. Oge said, I think it's really important as we close, you really want to register, because God has blessed our country to have this. There's countries, India right now, and countries that don't have access. Yes. And to just have them bring 100 doses of the vaccine and not have 100 people, is really not of God, when it's a blessing that we have. So you really want to register. Now, if you're beyond registering, you heard last minute, we don't want you to not come because you didn't register. But it's easy to register, and it makes sure that we have sufficient amount of vaccine and we're not throwing anything away. That's really, really important. Old school would say, you better eat that food on your plate. You got other people that are starving, don't have food, and you're like, well, I'm not in that other place. But the reality is that, there are this is a life and death matter. And let's not take the mercy of God and the grace of God for granted. And let's do our part. That's our faith part. That's our corresponding action. Register and sign up. You don't need to be part of Victory to get the COVID shot. We're just hosting a location. We're partnering with New Jersey. You don't need to go to church at all. We want you to come and get the vaccine, and it's our honor and privilege. Well, I want to thank y'all. We wanted to do 90 minutes. We did in a little more, 98 minutes. So I just want to thank y'all tonight. I know that you're very busy. You have a lot going on. Dr. Oge, you were on call, and it held up. Prayer is real. It held up. And so thank you for navigating this, Dr. Oge. Thank you for all that you do. Dr. May, thank you for all that you do. Nurse Nicole, thank you for all that you do. I think it's so great that you guys are medical professionals and you still serve at Victory. Your provision for the vision, and you care. And I think that's why this was so important. You were sharing today medically, but from a heart of victory, knowing the culture of Victory, and it gives credibility to the ministry that we are putting safety first. We're not over spiritualizing it. We're putting safety first and doing the Bible says, the natural and the spiritual. And we'll continue to do so. To all those watching part of Victory, before we will go forward, regardless of what the governor says, we will consult with our medical team, we'll dialogue, and we'll talk about the proper rollout. So when you hear me say I've consulted with the medical, doctors and professionals in church, it's these individuals plus a few that are not here. And so you've heard from them tonight. They know what they're talking about. They have decades of experience. And because they're part of Victory, they will help us make wise decisions so that we open up back to where we were. We open up right, correctly, and safely. And so if you hear us go, hey, we're still keeping our mask going for another month, or we're doing seating this way, it's because we want to make sure that we're doing it well. The good thing is we recognize a lot of people coming to our church have been vaccinated. That's great. That's great. But there's a whole lot of people, part of our church, that haven't come yet because they're not vaccinated. And we want everybody that wants to get vaccinated to have an opportunity. All right, well, we are out of time. Thank y'all tonight. Thank y'all from the bottom of my heart. Online, can y'all show some love to these precious medical professionals? Yes. Facebook, YouTube, can y'all make some noise? Yes. Can y'all make some noise for Dr. May, Nurse Nicole, Dr. Oge, yes. Dr. Oge, Captain America, Dr. May, Wonder Woman, that is their new names, and Nurse Nicole, superhero in the flesh. We appreciate you, and we thank y'all for tonight. This has been great. This has been really good. Hopefully, and I believe we made a lot of progress in helping people walk through the myths and, and correct incorrect information and get accurate information to help them make a decision of whether it's next week at Victory or someplace else to get vaccinated so that we can reach herd immunity and protect ourselves and our fellow men. So thank y'all so much tonight. Have a great night. We appreciate it. And we'll talk to you soon. You know, I got to talk to y'all. Everything's changing. So I got to talk to y'all. So have a great night. Thank y'all. Love you guys. Okay. All right. Have a good night. Be blessed. Be blessed.